Order. I'll call Will Quince to move the motion, and I will then call the Minister to respond. There won't be an opportunity for the member in charge to wind up, as is the convention for 30-minute debates. Order. Will Quince to move the motion.
Thank you, Mr. Dowd, and it's a pleasure to serve under your chairmanship. I beg to move that the House has considered antimicrobial resistance. Up until November of last year, I had the privilege of serving as Minister of State at the Department for Health and Social Care, alongside my honourable friend, the Minister, who I'm pleased to see in her place today. And it was a pleasure, if I may say so, Mr. Dowd, working alongside her. She will know that it is a department where, despite your best efforts, you spend a considerable amount of time firefighting and dealing reactively with issues. And during my time in the Department for Health and Social Care, there were many pressing issues that concerned me, some of which remain today, but there was one in particular that scared me. If I told the House that there was an issue that was so serious that it is a top World Health Organization global health threat, that it sits on the UK's national risk register, that it costs the NHS around £180 million a year, would we be surprised if I said that most people weren't aware of it? What about if I said that globally there were 4.95 million deaths associated with this, and 1.27 million of those were directly attributed? Now, what if I said that 1 in 5 of these deaths are in children under the age of 5? Or how about if I said that deaths in the UK related to this are estimated to stand at 12,000 per year? That is the equivalent of deaths from breast cancer. And what if I told the House that 10 million people each year, and I'll repeat that figure, 10 million people are predicted to die globally by 2050 a year if urgent measures are not taken? Now, today's debate is about antimicrobial resistance, or AMR. Now, I wonder if we walked out into Parliament Square now and asked 100 people at random what AMR is, how many we would suggest would know? For the reasons I've just set out, we should be aware and concerned about AMR, and we should be pushing our governments globally, and the World Health Organization to do more to highlight and take steps to address this top global health threat. Now, AMR occurs when bacteria, viruses, fungi, and parasites no longer respond to antimicrobial medicines. As a result of drug resistance, antibiotics and other antimicrobial medicines become ineffective, and infections become difficult or indeed impossible to treat, therefore increasing the risk of disease spread, severe illness, disability, and sadly death. Now, whilst resistance is a natural phenomenon and not just a health issue, from a human healthcare perspective, it is accelerated by inappropriate use of antimicrobial drugs, poor infection prevention and control practices, a lack of new antimicrobial drugs being developed, and insufficient global surveillance of infections rates. Now, as I said, the World Health Organization has declared AMR as one of the top 10 global health threats. And AMR is listed on the UK government's National Risk Register, as I said. Now, in 2019, as I said, there were 4.95 million deaths associated with bacterial AMR across 204 countries, and 1.27 million of those were directly attributable, and again, leading the WHO to declare it a top public health threat. Now, the OECD found that 1 in 5 infections, I'll repeat that again, 1 in 5 infections are now resistant to antibiotics, with the potential for this rate to double by 2035. In 2021, there were 53,985 serious antibiotic resistance infections in England, which is a rise of 2.2% from 2020. And if left unchecked, resistance to third-line antimicrobials, the last resort drugs against difficult-to-treat infections, could be 2.1 times higher by 2035. Now, this means that health systems will be closer to running out of options to treat patients that are suffering from a range of illnesses, such as pneumonia and bloodstream infections. Now, despite this, and this, Mr. Dowd, I think is the really concerning part, no new class of antibiotics have been developed since the 1980s. So preserving and optimising our current antimicrobial arsenal is therefore not just urgent, but it's paramount. The consequences of AMR are huge. For urinary tract infections caused by E. coli, 1 in 5 cases exhibited reduced susceptibility to standard antibiotics. This is making it harder to effectively treat common infections. AMR also presents a threat to malaria control. Antimicrobial resistance is putting the gains of modern medicine at risk as it makes surgical and medical procedures that are a normalised part of everyday life, such as a caesarean section or cancer chemotherapy or hip replacements, far more risky. In addition to death and disability, AMR has significant economic costs. AMR creates the need for more expensive and intensive care, affects productivity of patients or their caregivers through prolonged hospital stays, and, side issue I appreciate, but harms agricultural productivity. And the World Bank estimates that AMR could result in $1 trillion additional healthcare costs by 2050, and $1 trillion to 3.4 trillion gross domestic product, so GDP US dollars, losses per year by 2030. Now, considering the huge risk that AMR poses to health security across the world, I don't believe that enough is being done globally to combat this current inevitability. Let me start by praising the UK government for its action in this space, in particular the AMR 5-year action plan, or NAP, to contain and control AMR by 2040, which the NHS long-term plan details commitments to implement. And I look forward to the update beyond 2024, which this period is up to. And I could focus the rest of this speech on what more the UK could and arguably should be doing. We do need to see more on robust monitoring and surveillance. We need a significant public awareness campaign and greater investment in diagnostics and monitoring and screening, in particular around rapid point-of-care testing at a local system level, and vitally, greater focus on infection prevention and management. But I want to spend the rest of the time available to me focusing on international efforts and the role that the UK can play.
Well, my honourable friend, give way.
Of course, of course.
I'm very grateful to my honourable friend for bringing this very important matter to the Chamber. Before he moves to the international lens, would he reflect on the contribution that bacteriophages can make? These are the subject of a report from the Science and Technology Committee, and in effect they're viruses that eat bacteria. There is no approved manufacturing plant in the UK at the moment, and therefore it's impossible to license phages for clinical use. There is a facility in Leamington Spa that was used as one of the lighthouse labs that could be repurposed for that. Would my honourable friend agree with me that the government might find that a useful way to address the very significant problem that he describes?
Well, I thank my right honourable friend for bringing that to my attention. It wasn't something I was aware of, but I think given the gravity and the seriousness of the situation that we face, not just here in the United Kingdom, but globally, I think we need to look at all potential tools in the arsenal to tackle this issue. So I hope the Minister has heard the case that my right honourable friend has made very powerfully, and I'd be very happy to meet with him afterwards to find out more about it, because it sounds incredibly interesting. And where he's right, although I want to focus some time on the international effort, the battle is not won here in the UK, and we have far more to do, and the Department of Health and Social Care and NHS England have an important role to play. Mr Dowd, I know from first-hand experience, including representing His Majesty's Government at the World Health Assembly and the United Nations General Assembly when I was Minister of State, the global leadership that the UK shows through the World Health Organization, especially in partnership with Sweden. And I was proud to be able to announce during my time an investment of £39 million into research through the Global AMR Innovation Fund to help tackle what is a silent pandemic. And I understand that 24 million of that has been awarded to bolster the UK's partnership with CarbX, a global AMR research initiative to support the continued early development of invaluable new antibiotics, vaccines, rapid diagnostics and new products to combat life-threatening drug-resistant infections and, of course, to prevent death and disease across the world. And I'm also proud that the... Of course I'll give way, of course.
To bring this forward, and just something that's been in my mind for some time. I know I've asked a number of questions, Mr. Chairman, in relation to antibiotic use. I understand that it's been increasing greatly according to all the stats and questions to the Department as well and the Ministers. But does the honourable member not agree that during COVID the standard was set whereby many GPs and out-of-hours practices had to prescribe antibiotics without seeing patients? And we need to return to the prescription of antibiotics being given after examination to determine whether absolutely necessary. We can't keep on giving them out, can I say, Mr. Chairman, willy-nilly. We have to do it under strict controls.
Point, and he is absolutely right that we need to readdress our approach to antibiotics. And yes, there is a role for clinicians in that. And you know, a 10-minute slot is not a lot of time to diagnose. And I know that lots of people will go in to see their doctor, and the first thing they will say is, I have an infection, I need antibiotics. That may not be the case, and we have to trust clinicians. Also, the government's new Pharmacy First initiative, which is taken very seriously by pharmacists, I know, has very strict controls and surveillance around the use of antibiotics. So I know the UK government, the Department of Health and Social Care, take it incredibly seriously. Where my honourable friend alludes to, and he's absolutely right, and this is what worries me, if you go to many countries around the world, antibiotics are available off the shelf in the same way that paracetamol or ibuprofen is. I spoke to, I won't name the country, but the health secretary for a particular country that's in Africa said that people routinely keep antibiotics in their medicine cupboard at home, and if they're feeling unwell, they'll just take a few. This is causing huge problems. So there's an enormous awareness campaign and education piece that we need to do around antibiotics. And actually, that their use can be harming us all in the medium to long term. So my honourable friend raises a really important point. I also want to touch on the government's Newton Fund that supported over 70 research teams to conduct crucial research on strategic areas, including AMR. And through the Fleming Fund, which is a brilliant fund, the government's invested 265 million supporting countries around the globe to generate, share and use data on AMR. And I'm proud that this is the world's single largest aid investment into AMR surveillance. Now, I couldn't not mention, as part of this debate, the role played by Dame Sally Davies, who is the UK's Special Envoy on Antimicrobial Resistance. And I saw firsthand, both at the WHO and the UN General Assembly, Dame Sally's global leadership and how widely respected she is on the world stage on this issue. And if I may say, Mr. Dale, we are very lucky to have her. Internationally, there is movement. And of course, I welcome the landmark 2015 WHO Global Action Plan on AMR, which was followed by, in 2016, the historic UN Declaration on AMR, and more recently, the One Health Group Leaders, or One Health Global Leaders Group on AMR, which was founded just a handful of years ago to provide leadership and maintain political momentum on this issue. But, Mr. Dowd, I believe this issue is so serious that more urgent and immediate action needs to be taken. We know there are countries where antibiotics, as I said to my honourable friend, the member for Strangford, are routinely kept in cupboards and medicine drawers at home and taken when people feel unwell. We know there are countries where antibiotics can be purchased over the counter or online without seeing a doctor or physician. So what action, I suppose my question to the Minister, what action could and should we be taking? Well, I think we need a significant domestic and international awareness and understanding campaign on AMR. We need governments in our respective nations to understand the risks of failure and the public to understand the impact that's on them and their families, the urgency of the situation and the calling, and we want them to be the ones calling for action. We need to do more to promote appropriate and adequate global surveillance for AMR to detect and strengthen our knowledge and evidential base. Incidentally, doing that will also help with identifying potential future pandemics, so there is a dual benefit there. We need to work towards an international agreement on common evidence-based goals and support other countries to deliver against them. We've got to use our ODA, or overseas aid budget, to help reduce the incidence of infection through effective sanitation, hygiene and infection prevention measures. And we need to use, to the best of our ability, the UK's political positions on international platforms, our soft power, including, of course, our ODA spend, and, of course, the formidable Dame Sally Davies and our UK expertise to continue to provide global leadership on AMR. And finally, Mr. Dowd, I just want to say I hope that the Minister can commit to supporting and continuing to fund the work of the World Health Organization on AMR. So I hope, Mr. Dowd, that I've, in the short time available to me, shorter because I appreciate I was racing to get here in time following the votes, been able to set out why antimicrobial resistance is the issue that concerned me most when Minister of State at the Department for Health and Social Care, and continues to concern me as I am on my glide path out of politics. I genuinely think it should greatly concern all of us. I hope that the Minister and future ministers will continue to keep this issue front of mind and treat tackling it with the urgency and seriousness that it deserves. Thank you.
Yeah. Is that this House has considered antimicrobial resistance. Minister.
Thank you, Mr. Dowd. It's a pleasure to serve under your chairmanship. Can I thank my honourable friend for Colchester for bringing forward today's debate, and in particular his contribution to the Department of Health and Social Care during his tenure as a minister, and in particular his work on this very issue. It's a pivotal year, actually, for confronting antimicrobial resistance, because the emergence of resistant infections is relentless and has, as he so eloquently described, the pipeline for new antibiotics is running dry. And the evidence is stark, not just domestically, but globally, with more than 1 million people dying every year from infections that have become resistant to treatment. This exceeds the number of people who die from HIV or malaria, just to put it into context. And AMR is sometimes described as an ignored pandemic, but if we don't act, the cost of treating resistant infections could compare to having a pandemic like COVID-19 every 5 years. And he is absolutely correct to say that if you were to walk outside of this place, many people would not understand what AMR is or really appreciate the consequences of us not dealing with this either domestically or internationally. That is why we are committed to addressing antimicrobial resistance. He's right as well. In 2019, we published our vision for antimicrobial resistance to be contained and controlled by 2040, and that date is looming ever closer. But this vision recognises this is a complex problem, and there's really 3 tiers to the way that we're tackling it. Firstly is to lower the burden of infection, both in humans, and he did touch on this slightly, but also in animals, because if you don't get the bug, you won't need the drug. And the second is to only use antimicrobials when absolutely needed, but using them correctly too. And this is also true for both people and animals, which I will touch on in a moment. But thirdly, it's about developing either new antibiotics or new technologies to be able to treat some of these infections. So we do have more tools in our armour as resistance emerges. But we can all play our part. And I just wanted to make a bit of a public health plea to everyone, really, because we've all got our responsibilities to either finish courses of antibiotics that are prescribed to us, because very often if you finish your course or you don't finish your course and feel better and think there's no need to take the rest of it, that is a key way of developing resistance. But also keeping that strip for the next time you have an infection, and self-medicating is equally harmful. And so while we do know there's bad practices in other countries, we've all got a responsibility in either taking our antibiotics as prescribed or not self-medicating should we have some looming in our cupboards. I will give way.
I'm very grateful to the Minister for Way. for giving way, and pay tribute to the honourable member for Colchester for securing this debate. There's on what we can do. There's a brilliant Radio 4 documentary called Swimming in Superbugs, and on that, Dr. Anne Leonard from the University of Exeter Medical School talked about her Beach Bums project, where people who use the sea are 3 times more likely to have antibiotic bacteria in their gut. Does the Minister agree that we should not be importing human sewage sludge for spreading on farmland, given that we think that traces of antibiotic-resistant material might have ended up in the sea?
That goes back to my first pillar in terms of reducing and preventing infections in the first place. And we need to do that domestically, but also internationally. We are doing huge amounts of work in that space to improve water sanitation. But in animal health as well, we've also been doing a huge amount of work, particularly around antibiotic use in food. In animals that are used in food production, the UK has reduced by 59% the amount of antibiotics going into the food chain, which has a knock-on effect. We're also investing in innovation and capitalising on our world-leading science, including, as the Right Honourable Member for Tunbridge Wells pointed out, in phage therapy. And I haven't actually heard about the Leamington Spa facility. I'm very interested in kind of catching up with him after this debate to see what more can be done, because the National Institute of Health and Care Research is investing almost £90 million in this type of research. And so if there is a potential of developing that further, we're always keen to hear it. But our plan is cross-sectional. It's the One Health approach, recognising the links between the health of humans, animals and the environment, and the spread of resistance between them. We have got our National Action Plan, which is not limited to activity in the UK. We all know that infections don't respect borders, and that's why, as my honourable friend from Colchester pointed out, we are working internationally and taking a lead in many elements of this across the global community, and particularly with our UK Special Envoy on antimicrobial resistance, Dame Sally Davis, spearheading some of the efforts. And he pointed out to the action plan, just to update him on the action plan post-2024, we are working that up as we speak, and we hope to make an announcement soon, so that there is an ongoing piece of work to drive forward some of the changes across those 3 sectors. Now, while we're doing our bit here and we are leading internationally, he did touch on what is happening in other countries. Now, low and middle income countries have to be part of the change in order to be able to safeguard us against antimicrobial resistance. I will give way.
From some of the groups that I speak to, Mr. Chairman, and they mention here, and I quote them, the need for Group B strep screening in pregnant women during labour instead of using antibiotics for all routinely. I know the Minister is really interested in that subject matter, and I know that she'll have an opinion on it. Would the Minister agree that maybe this is a chance to raise awareness of that particular issue?
He's absolutely right, and I will come and touch on much more that we can do about screening to prevent some of those infections as well, because it cannot just be about developing new antibiotics. It's about preventing infections and screening for infections in a range of scenarios. But just to touch on some of the high prevalence we have internationally, 89% of all antimicrobial resistance deaths occur in Africa and Asia, and so we do have a responsibility to make sure that we're helping out in those countries that are struggling the most with this issue. We must continue to ensure that people around the world have access to the antibiotics they need, and that is why £40 million in innovative research through the Global AMR Fund that my honourable friend touched on is so crucial. It's enabled the development of a new antibiotic for drug-resistant gonorrhoea, the first in 30 years. The honourable gentleman I can't remember which constituency he's from, I'm very sorry, touched on the role of water. But this, true, is also an international effort, because we do recognise that in other countries, sanitation is often a leading cause of infections, and that's why we're working so hard with other countries and with the WHO to improve water sanitation and hygiene to reduce those infections occurring in the first place. In 2022, we also made a further £210 million commitment for the second phase of the Fleming Fund to strengthen our surveillance systems, because, as the Honourable Member for Strangford said, it isn't just about treating, it's about picking up infections and trends and trying to prevent those infections in the first place. And the Fleming Fund is having an impact. Since 2015, over 240 laboratories have been upgraded with state-of-the-art equipment, training and new systems, and over 75 national action plans on AMR have been developed in Africa and Asia to try and get that death toll down from antibiotic resistance. The Fleming Fund leverages UK expertise with over 3,000 healthcare workers being trained in antimicrobial surveillance principles through partnership with the NHS. So looking ahead, we recognise the risks. We are not being complacent either domestically or internationally. We have, and through the hard work of my honourable friend from Colchester, put some really good building blocks in place, but we do also need to look to the future as well. Our next 5-year antimicrobial resistant national action plan will be published later this year, which I will give way.
I'm very grateful. I'm grateful for what you said about phages. She knows that UK science is world-leading, especially in this area. In Imperial College alone, there are 180 researchers working on AMR. One of those researchers, Professor Jonathan Cook, has pointed out the real benefits of point-of-care testing, and that other countries, including the Netherlands, have managed to make a big impact. Can the Minister say whether we have plans to accelerate the availability of such testing in this country?
It's something I will take away and follow up on, because there are some really good examples of this in primary care where there is some testing that is done, particularly with primary care nurses who will do point-of-care testing to see if someone's infection is actually going to be sensitive to antibiotics or not. I do believe there's more we could do in that space, both in primary and secondary care. So I'm very happy to write to him to update him on how we can roll that out more nationally. And important that it helps maintain patients' expectations. I can't remember who said it in the debate, but people do go along to GPs and expect to be given antibiotics. And actually point-of-care testing will be able to reassure them that they either do or don't need antibiotics, and which type of antibiotics is best suited to their type of infection. So absolutely that is important. Our plan is going to set out an ambitious programme of work, learning from COVID-19 in terms of testing, surveillance and treatment, so that we can learn for infections for the future. But we will continue, I can reassure my honourable friend from Colchester, to collaborate internationally with organisations such as the WHO, use our soft power and help support particularly African and Asian nations who are suffering so much from the mortality of antimicrobial resistance. This is a hidden pandemic, but it's one that will have consequences for us all if we do not deal with it. Thank you.
Thank you. The question is that this House has considered antimicrobial resistance. As many as of that opinion say aye. Of the contrary, no. I think the ayes have it. Order. Order. No, don't worry, it's okay. No.